Preparation of polysilicone. It is an essential step to get accurate dental arch form for successful invisible orthodontics. Taking silicone impression is one of the most desirable methods to get high-precision model, and the impression can keep the original form for a relatively long time. We recommend using two-step technique instead of the one-step to take impressions in order to get higher precision impressions. Since clinical data shows two-step technique will get a higher precision impression compared with one-step technique. Basic requirements of impression. Basic requirements of the impression. 1. Make sure that all anatomical structure of each dimension is clear and complete, without any bubbles on the teeth surface. 2. The gingival margin should be clear, continuous and complete, and the impression should appropriately extend in buccal, labial surface and lingual-palatal surface, and exceed MJG, mucogingival junction, at least 2 mm. 3. For those with the third molar, the impression should at least cover 1/2 of the mesial side of it, and if it moves in the design, the impression has to cover the whole of it. 4. Offer occlusion records if the patient's occlusion is not stable. Preparation before taking impression. Plastic impression tray, plastic wrap, polymerized initial impression silicone, syringe mixing final impression silicone, timer. Preparation before taking impression in clinic. 1. Ensure that you have the right size tray for the patient's mouth. The tray should extend beyond the last tooth in the arch. If the distal edge of the distal molar is insufficiently covered, a wax extension can be applied. 2. Take the square sheet of plastic wrap over the tray. 3. When mixing the materials, the dental assistant should not wear latex gloves, but polyethylene gloves are permitted, and the assistant can mix by wash bare hands. Initial impression. 1. Get equal amount of putty A and B by the size of the patient's arch. Mix quickly with your finger, not palm, in the shortest possible time. Fit the initial impression material into the tray, and place the square sheet of plastic wrap over the tray, ensuring that the plastic wrap can cover the tray. Pulling the retractor toward the respective ear, rationally seat the tray in the patient's mouth. Ensure the rear part sits first after aligning with the midline. Gently press the tray programmed from back to front to firmly sit into the teeth, and the initial impression is extruded out of the mesh. Wait for the material to set for 3 minutes. Then take the tray out and remove the plastic wrap. 3. The initial impression should cover the complete dentition. The initial impression is to prepare individual trays, requiring a complex shape of the dental arch with porcine teeth structure. Final impression. 1. Express the final impression material into the indentations in the tray with an impression syringe, and ensure that the injection head is always buried into the indentations to prevent bubbles. 2. Pulling the retractor toward the respective ear, rationally sit the tray in the patient's mouth. Ensure the rear part sits first after aligning with the midline. Gently press the tray programmed from back to front to firmly sit into the teeth, and keep pressure on the tray until the final impression material overflows from the edge. 3. Wait for the material to set for 3.5 minutes, then take the tray out. In order to facilitate this location, you can gently pry the tray up and down. Further, when it is difficult to remove, you can use an air gun to blow air from the inside to relieve the negative pressure in the impression.
Qualifications for proper impression.
1. All teeth are clearly registered. 2. The anatomical structure of occlusal surface, labial-buccal surface, and linguopalatal surface of teeth is clearly registered. 3. The gum tissue is continuous, complete and clear. 4. There are no voids or tears. 5. The final impression adheres closely to the initial impression. 6. No demolding. Preparation of silicone occlusal registration. Silicone occlusal registration can be made by using special silicone for occlusal registration, or the initial impression material can be applied. Operation time of special silicone for occlusal registration is generally about 30 seconds, and the consolidation time in mouth is about 1 minute. However, the operation time of initial silicone impression is about 2 minutes, and the consolidation time in mouth is about 3 minutes. The occlusal registration represents the occlusal state of the maximum intercapsule occlusion position. The patient needs to be taught to bind in the maximum intercapsule occlusion position before occlusal registration. Mix and shape a small and equal amount of putty A and B into a dental arch type. Place the material on the lower dentition and ask the patient to bind to the maximum intercapsule occlusion position. Dentists should observe whether the occlusal relationship is correct in time and take out the occlusal registration after the impression has set. Requirements for silicone occlusal registration. 1. Ensure the occlusal registration is in the maximum intercapsule occlusion position. 2. The occlusal registration should be accurate, continuous, and complete.